Hello, and welcome to Public Health Live, the third Thursday breakfast broadcast. I'm Joyelle Ray Alexander, and I'll be your moderator today. Before we get started, I would like to ask that you please fill out your online evaluation at the end of the webcast. Continuing education credits are available after you take our short post test, and your feedback is helpful in planning future programs. We encourage you to let us know what topics are of interest to you and how we can best serve your needs. As for today's program, we will be taking your questions throughout the hour by phone. The toll-free number is 800-452-0662, or you may send your written questions by fax. The fax number is 518-426-0696. We will also be taking questions by email. Please email us at any time throughout the hour at phlive.newyork@gmail.com. Additionally, the School of Public Health would like to remind you of the new companion guide for the Public Health Live program. The guide can be found on our website, phlive.org, and will provide guidance, discussion points, and learning activities for those looking to enhance their learning experience with our program. Please visit our website at phlive.org to download the guide for today's program. Today's program is Social Media, Changing Communication and Interventions in Public Health. Our guests are Dr. Jennifer Manganello, an associate professor at the University at Albany School of Public Health, and John LaDuca, the director of digital communications at the New York City Department of Health and Mental Hygiene. And thank you both for being with us today.
Thank you. It's nice to be here.
It's great to be here. Thank you.
Jennifer, this broadcast is about social media, a term we hear a lot about these days. And as I understand it, social media is a part of what's considered the new media. Can you speak to us a little about what that exactly means?
Sure, that's a great question. We've been hearing a lot of different terms as all these new technologies are becoming popular. And a lot of people get confused. Well, what is social media? What is new media? How does that compare to the internet? So what I like to think of new media, when I think of new media, I think of it as newer technologies. So things where we are talking about internet, CDs, DVDs, whatever the newest technology is for that time. And that's compared to kind of the traditional media, things like TV, books, magazines, newspapers, media forms that have been around for quite some time. So social media really fits under this new media category, and so it's something that's constantly evolving. It's a newer technology, and that's kind of how the two terms relate to each other.
Okay, terrific. Thank you, Jennifer, because what that does, Jen, is it lays the foundation for us today. And now can you talk to us a bit more specifically about what exactly is meant when we use the term social media?
Sure, yeah. So usually when we're talking about social media, we're specifically talking about a media format that's often user created. So we're talking about something where users are directing the content, creating their own content, editing content, things like that. It's often used, a lot of social media exists on the internet. So whereas in the past you would have a website that would have information on it that was static and you could go and read that information and learn about what you wanted to learn about, now we have this more interactive format known as social media where we can actually, as a user, create and edit our own content within that media.
Okay, and how does social media fit in with the idea of having a participatory internet?
Right, so you might have heard the terms Web 1.0 and Web 2.0, and again, Web 1.0 gets at this idea of the readable internet, so kind of the original way that we came to learn about the internet. Web 2.0 really gets this idea of reading and writing on the internet. So social media is a subset there. So it really relates to the fact that you can, again, users are creating their own content. Within social media, as you can see from this chart here, there's also this idea we've heard about called social networking. That's referring to when we're connecting with people in our social network, our professional network on the internet, and that's a subset of social media there. So there are social media sites that are not specifically social networking sites, and we'll talk more about that distinction later.
Thank you. People also use the term e-health. Can you talk to us today about e-health and what it is and how it relates to social media as we're discussing right now?
Sure. Again, just to be clear about these different terms so everyone has an idea of what we're talking about throughout the broadcast, I think that's great to talk about e-health. And eHealth is really referring to this idea where we're using emerging technology to communicate health information and improve healthcare and health outcomes. So we can consider the internet as part of eHealth. We consider social media as part of eHealth. Again, anything where we're using some of this newer media for health-related purposes, we can really fit under the rubric of eHealth.
Now, what about mHealth?
That's a great question. So we hear eHealth and mHealth a lot, and some people will use them interchangeably. I see mHealth as, again, a subset of eHealth. And when I talk about mHealth, I'm referring to those tools that are actually based on mobile or wireless devices. So whereas you may be accessing a social media site on your desktop computer, I would consider that eHealth. Once you start accessing that site on your mobile phone, then I would start thinking of that more as mHealth. And things like text messaging, any of these things where we need to use a cell phone or tablets or any kind of wireless device, again, I would fit under the idea of mHealth.
So clearly, the way in which we provide public health information is changing. There's no doubt about
Yes.
it. Can you talk to us about specific ways the internet can be used to support public health?
Sure. Well, the internet really becomes the basis for a lot of this information. There are tools that are not internet-based, but many of them are. And there's a lot of different ways people have been using the internet to provide public health information and services. A lot of organizations, for instance, will have their own website, and that will tell people what kind of services they provide, how to contact them. It may have basic information about public health issues on there. There's also information websites, so there may be a whole website dedicated to something like Lyme disease, and you can go and read about different things related to that condition. We can also use the internet to actually put up videos, pictures, trainings, webcasts like the one we're doing today. So that can be really helpful. And then again, a lot of these social media sites are based on the internet. So for instance, Facebook is, you access that using the internet. It's an internet website. And you may also, as an organization, have links to your other social media sites or things like that on your actual homepage. So the internet can really be useful. And here we see an example of that. So this is a New York Department of Health website. This is a screenshot of their homepage. And what you can see here is that they have a list of different topics in the middle of the page. And on the left and the right, there's different links to access other types of information. What you see with the green circle that the arrow is pointing to is their links to their different social media sites, so Facebook, Twitter. And so you can look at this website, get the information you may need, figure out who to contact if you have questions. But then if you want to then use the social media sites that they're operating, you can see the link clearly, click there, and be brought right to their Twitter or Facebook pages.
Now, this site is particularly important as it relates to public health. But my question is, are most people using the internet? Do we have any data on who actually uses the internet and would be able to access this type of information?
Yes, I think that's a really important question. I think with all of this new technology out there, what's really happening is that a lot of people are really relying on the internet and a lot of these tools to get the information out. And I think sometimes at the point where we forget that there are other ways to get information to people. So it's important to understand whether everyone is online or not. And I think right now, the numbers have been skyrocketing over the last decade. And so we're up to about 80% of adults using the internet and 95% of teens. So those numbers are quite high. And so I do think that there are a lot of people at this time who can access the internet. And the rise of mobile phones has really increased that, which we'll talk about in a few minutes. But I think it's important to remember that there really are groups that still are not online, and I think that's something that people don't think about. Some of the people that do not use the internet are typically older, so you see 53% of those who are age 65 and older are not online, so that's just about half of that age group. People who speak Spanish as their primary language are typically online less. People who have less than a high school education or low-income groups are less likely to be online, as well as some of those people who have disabilities such as vision issues. That makes going online very challenging.
Jen, what we sometimes hear about the digital divide, and you look at that data, and it seems to highlight that. What can you tell us about the digital divide? Is it about use or access?
I see it as really being both. For many years when people talked about the digital divide, it was really this idea that, okay, there's this group who are online and there's a group who is not online. And so it was this idea that the people who could not get online were really at a disadvantage because they weren't able to access the information. More recently, there's been a lot more talk about how people get online. So there's this term being used now, digital access divide. So there are a lot of people now who are now online who were not online before and were on the other side of that digital divide. However, a lot of those people are mostly getting online on mobile phones. Those people are typically likely to be younger, non-white, have no college education, and have lower incomes. So, you know, they are getting online, which is great, and we've seen that digital divide decrease. But one of the issues to remember is that people who are accessing the internet through mobile phones have a different kind of access. In other words, you know, there are many sites that you may go to that will look different on a mobile phone versus if you're on your desktop or laptop. So we have to make sure when we're designing sites that we're considering that there are groups of people who solely access the internet online. The other thing is they're subject to the limitations or cost of wireless plans and data downloads. You know, if you have a plan that has limited data use, you may not be able to get online as much as you would like, and you have to only go online for the things you really want to do. You may not have the data or time allowances to go on and access, you know, search for health information all day long. The other thing that is really that people are more limited in what you can do with a phone versus a desktop. So if I'm on my desktop and I go to a website and I have to fill out a form, for instance, I can open the link to the form, fill it out easily. If you're on your phone, something like filling out forms, creating Word documents, things like that, it's much more challenging. So we have to think about what limitations people have who are accessing the internet just through their mobile phone.
Well said. Let's look specifically now at some social media tools. Can you start by introducing some of them to us today?
Yeah, sure. And I think a lot of these will be familiar to people, but I think it's good to just go over them quickly. I think everyone's heard of social networking sites. So these are sites like Facebook and MySpace, and we'll talk more about these in detail in a couple of minutes. Things like microblogs where you have these kind of brief text updates, that would be an example, like Twitter. Online video and photo sharing is often considered a social media tool, things like blogs, online communities and forums, and there's a whole host of other things.
Clearly, there are a lot of potential tools out there, but for departments that are struggling and, you know, with already having enough work to do, what's the benefit of starting to use these tools to reach a particular population, and why should they use social media tools?
Right. Well, I mean, that's really a good question because there are a lot of departments out there who have limited resources or finances, and, you know, why should we think about this? Well, I think one thing that's really important is that these are tools that people are using and are very familiar with. And so there are a lot of people who, you know, that's their main way of communicating now is through sites like Facebook or things like that. And so you may be missing them if you're not engaged with some of those tools that people are using. I think it's also great because it's a way to get information out to people very quickly and to share information. They can be fairly inexpensive to set up. But it also allows people to share their views and to be interactive, to give their comments and questions, which is different than just putting your information up on a website and having that be very static. So it allows people to feel that they're interactive with your organization, that they can engage with your organization, and I think that can make a real difference in terms of how people perceive the services that you can provide them or the help you can give them.
So the expression, the social media train has left the station, and departments should recognize that and get on board. And are there resources available for departments that would like to start using social media, but perhaps don't quite know where to begin?
Yeah, there's a lot of resources out there. I mean, one thing I always suggest people do is to go and look at examples of what other departments have done. That's a great way to get started. You can see maybe what you like, what you don't like about existing examples. But the Centers for Disease Control recently came out with a social media toolkit, and that's a great resource because it really does go through each of the tools, explains what they're used for, and gives examples of how they've been used. So I think that can be a great place to get started.
Jen, what is social networking, and how is that different from social media?
Sure. Well, social networking, like we talked about before, is just a very specific subset of social media. And social networking sites are things like Facebook, MySpace, Google+, LinkedIn, which is more of a professional site. And what they are is they're sites where you can connect with people that you know in your network. So if you go to a site like LinkedIn, you can go and become connected with those that you know professionally. And so it creates a way for you to stay updated with where people are, what they're doing, be able to communicate with them. Sometimes people switch jobs or email accounts. You may not have their new contact information, but you can keep up with them this way. So it's really a way to connect with people in your social network, but also it's important to understand that you can connect with organizations and groups as well through social networking sites. So for instance, on a site like Facebook, you can actually like a particular organization, such as a public health department, and get updates from them and see any news items that they're posting. So that's what's, I think, a real benefit to the public health departments.
Absolutely. Jen, can you tell us anything about the demographics of who tends to use these particular social networking sites?
Yeah, well, I think in terms of social media, some of the highest numbers we see in terms of use have to do with social networking. And you'll see on this slide coming up that the percentages are quite high. You will see that the use goes down as people get older, but even people in the 65 and up age range, still about a third are using social networking. We do see slightly higher and more regular use, meaning using it on a daily basis, that kind of thing among women. And it's also important to remember that which sites are used can vary by demographic. So for instance, certain groups may have a preference for Facebook versus MySpace or something like that. So that's a good thing to know about in terms of who you're targeting to get your information to.
Well, let's talk about that little thing known as Facebook, which seems to be obviously the best known of all of them. Can you tell our audience what exactly is Facebook?
Yeah, I mean, Facebook is a specific social networking site. It's hard to actually explain it because it's just so out there now. But it's it's a site, again, where you can connect with your friends. So what you do is you can search for people you know. It's called friending. You friend them, and once you friend them, you're able to see any of their news updates that they post, pictures that they post, things like that. Again, you can also like a page for an organization or a company or whatever, and once you like a page, you're also going to see their updates or news items in your kind of what's called a news feed as well. So what's really interesting about Facebook as opposed to a typical internet site is that the content is different for every single user, because each user is going to see their own content based on who they're friends with, what organizations they like, and things like that. So it's really hard to get a sense on what content people are exposed to on Facebook. And one of the other features about Facebook that's nice is you can actually create discussion groups. They can be open, they can be closed. So it's a way for people to create kind of a social network of a group if they want to share information, things like that. So you can actually create subgroups within Facebook too. So there's a lot of different ways you can use Facebook, and we can see there's an example of the New York Department of Health's Facebook page here, which helps us kind of understand what Facebook looks like. You can see that they have some images at the top and they have a logo, and then down below you can see kind of who likes their page, and then you can see one of their news items posted, and that's what a Facebook page looks like.
Thank you, Jen. Thank you. That was extremely comprehensive. And I think that among organizations looking to branch into the use of social media, Facebook tends to be one of the most common options used, as Jen just highlighted. Let's take a moment to hear from Amy Barish at the New York State Office for the Prevention of Domestic Violence to hear how they have used Facebook and other social media to reach their target population around the very serious public health issue of domestic violence.
My name is Amy Barish, and I'm the Executive Director of the New York State Office for the Prevention of Domestic Violence. We started using social media in 2010, and we've been talking about it internally before we launched, because I think it's really important that you have, whoever you are, whether you're in public health, in the private sector, in the public sector, have a really good conversation internally about what you hope to get out of your use of social media. It's, the coin of the realm these days, and everybody's jumping in with both feet, but it's actually pretty labor intensive, and you need to decide what your goals are for it, what your resources are, and try to match that up to what you're trying to achieve. So we had an expert in social media come in and talk with us a little bit about, before we launched anything, talk about how to use social media and when it's useful and when it's not. And there are examples in all sectors of people who've entered into the social media arena without a real goal in mind and have spent a lot of time and energy doing that without much to show for it. When we thought about using social media, we thought first of Facebook, so that's where we went initially. And we did launch a Facebook page to try to create this community. We also use Twitter, though, very much, and all of our Facebook page posts are also tweets. So you can do that pretty automatically. So again, when we were trying to assess our resources and what we could handle, as long as that's set up to be automated, you can do that quite quickly. Every October, we do a public awareness effort because October is Domestic Violence Awareness Month. And what we've done is something called Shine the Light, which is an effort to really assemble all of the providers around the state who are doing something using the color purple, which is the color that represents the fight against domestic violence. They're using that in October for their own local effort. And what we realized is we could use social media to harness all of the efforts already going on and hopefully elevate all of them. So it gives them the added power that they might not have isolated in their own communities. And that seems to have been very effective. Every year it's grown and grown. We've also launched a Facebook page specifically for a younger audience called Respect Love, and I think that's been very important because government websites look a certain way and they're very unlikely to be appealing to teen visitors. And so we did a Facebook page that was test marketed among young people. They designed the slogan, they designed the graphics, and I think that has been a great way to be sort of a friendlier face of government and a place to share information that might be more appealing to young people. But I think a lot of the questions we had to ask in terms of what barriers are there to using social media probably exist in some way, shape, or form for others. Some of what we thought about were, first of all, cost. How do we maintain the social media presence? And I think there's a feeling, because many of us have our own Facebook pages and tweet, that it's sort of cost neutral. And the reality is it's not. The technology may be free, but the person power behind it is not free. And to get these tools to really be impactful, they need to be lively. You need to be posting pretty regularly. You need to be providing information people care about. To reach our target population, as I mentioned, we launched in February around a Teen Dating Awareness Month. And we did a press conference and a press release, so that was an initial way to reach people. We were also using our Facebook page to really communicate around Domestic Violence Awareness Month in the month of October. So I think we have done a very good job at saturating the natural stakeholder community for our agency. Where the challenges come in is trying to reach beyond that, because I see the mission of our agency as trying to reach people who don't necessarily think about domestic violence every day. So in the public health arena, for example, if you're talking to health workers, we believe very strongly and know that domestic violence is a public health issue. Not all health providers see it as one of the most important issues for them. So it might be important for us to get information out to them that they're saying they need, and then package that with some information about domestic violence. So I think when you're using social media, you need to figure out what does your audience want, what will bring them to you, and then how can you deliver additional information possibly while they're there.
It's great to hear about the success they're having by using Facebook. And they also mentioned the use of Twitter. Jen, what can you tell us about that? What is Twitter?
Yeah, Twitter it's another way to kind of get information out quickly, but it's very brief text updates. You can't have more than 140 characters in a tweet, we call them. So it's also another useful tool though, and we do see some lower percentages in terms of people who use Twitter, but it is still something that's being used. And a lot of times people do specifically use it to follow organizations or companies, so it can be a really great tool for health departments. And you can see here the New York Department of Health also does have a Twitter site in addition to their Facebook page. So you can see what that looks like here. And again, you just see in the center of the screen the different tweets that they've posted, and just little quick information bites. And in your tweets, you can link to another website or Facebook page or something with more information. So it's just a good way to get quick information out to people and point them to places where they can get more information on a topic if it's something they're interested in.
Now, we hear the most about Facebook and Twitter, but there are other ways of sharing information online as well. Can you talk to us today about some of the other ways of sharing information and getting information out there?
Yeah, sure. I mean, there's so many different things, and I think today I just wanted to highlight a few of the more common ones, but I think it's important to remember that there's a lot of different options out there, and so if there's something in particular you want to do, try to figure out a way to do it, because there's probably a tool for that. Another thing people will do a lot is online image or video sharing. Those are done on sites like Flickr or YouTube, and those are a great way. It's a great way to really show people images about things. You can use them for, training videos, visual demonstrations of how to do things. People have put public service announcements on YouTube, which has been a great use of that tool as well. The other thing is that you don't need a specific site like YouTube to post a video or a photo. You can actually do those things within your Facebook page or on your website as well. So it's important to remember that online image and video sharing can be done in a multitude of ways.
And what about Pinterest? That seems to be one of the newer sites, and it's evolving and it's dynamic, and it seems as though once you nail one social media or one form of social networking down, something else pops up. Can you talk to us about that?
Sure, yeah, this happened to me, last year someone said something about Pinterest and I thought, what is that? So instantly I had to go check it out. I like to be, up to date with all of these things, and I find it very interesting. It's actually a virtual pin board, so it's like a bulletin board, and what you can do is pin electronic content to the board. So I'll show you an example in a minute, but think about, in the past, if you're on the internet and you find recipes you like, for instance, you're always bookmarking the sites, and then you try to organize your bookmarks into folders or things like that. But it can be, I know for me, I'll go back and I can't find the bookmark or whatever. Pinterest is actually a visual way to save that electronic information. And what's great is you can, again, like people or follow people in your social network so that you can see what they're pinning. But you can also see pins from anyone. There's actually not, you can go to the whole Pinterest page and see anyone who's pinning things. So it's a great way to get information. It's been interesting because a majority of the users of Pinterest are female, and over half are between the ages of 25 and 44. A lot of the people using Pinterest are moms, and it's actually really widely used in the Midwest, so it's an interesting demographic. Some of the more popular categories includes things like recipes, fitness, crafts, home design. There's a lot of child-related topics. I know a lot of people who work in education, for instance, are using Pinterest to get ideas about different projects they can do in school and things. So it's interesting because I tried to find some examples of public health uses of Pinterest for the broadcast, and I actually couldn't find many. So I'd be curious to hear how people in the audience think that they could potentially use Pinterest. What I wanted to do is show you what Pinterest looks like. So Whole Foods has actually been pointed to as a company who's really using Pinterest well. I've read about it in a couple different places now. So what you can see here is that they have their Pinterest page and they have different categories. The one that I've circled is called Eat Your Veggies. And so what you would do is you can look at those different categories, click on one of them, and once you click on Eat Your Veggies, then that will bring you to all of the different pins. And so what you see here are pictures of different recipes using vegetables. And when you click on that picture, it will actually bring you to the website where the recipe is, whether it's on a blog or a food site or whatever. And you can see also that people, if you're following these pins or looking at the pins, you can like the pin, you can comment on the pin. So some of those functions, again, increase that interactive nature. So it's just another way to get information and share it with other people.
Pinterest came to my attention because one of the most popular women and moms out there today using it is Michelle Obama. And I believe she's using it to promote her anti-obesity and Let's Move campaign. So that's it's very interesting and extremely popular. You've talked about a few, but there are a number of other social media tools as well. Can you address some of those today?
Yeah, I think some of the other things to keep in mind are blogs. Again, I think people are familiar with the term blog, but a blog is just, you can do these posts, but they could be much longer. It's typically used for, longer, paragraph type postings about information or things that are going on, and people can comment typically on the blog post. There are online forums where you can have things like chat rooms where you can have different users can log in, or it may be just open to the public, and you can post questions, like what kind of car seats do you recommend or something like that, and people can respond to those posts. There's things called virtual worlds. An example of this is Second Life. Those are the tools where you would create an avatar or character type of thing and interact with others. And actually, virtual worlds have been used quite a bit in health. They've been useful in terms of training people in different health areas and things like that. There's also review sites, so sites like Yelp, for instance. You can go online, post reviews about restaurants, movies, whatever. Those kind of fall in the area of social media as well. And there's so many others, and there's new sites and new formats and new tools that are always developing. So it can be hard to stay on top of it, but I think it's good to know that there are always new options for you to use and to kind of stay up with what's the most popular at the time.
At the beginning of the show today, you talked about mHealth, and you drew the distinction between eHealth and mHealth. Can you tell us about some mHealth tools and what they might be used for?
Sure. I mean, mHealth, you can access a lot of these social media tools through a mobile phone, so that's one thing. But then there are tools that are very specific to a mobile phone that I would list more under the mHealth category. One of these is smartphone apps. So an app is a computer program that runs on a smartphone. So it can do things like help users find health services where they are, access nutrition information. You can do things like track a running route, get information about first aid, track medication use, and keep your blood pressure measurements. So there's so many different apps out there, and I think that there's a lot of ways that public health can use these apps. You can also have text messages. So you can send out text messages on mobile phones, and those can have health information in them, things like provider appointment reminders, medication reminders. There's been a program that's been talked about quite a bit called Text for Baby, where women who are pregnant can sign up to get text messages, and they send out weekly messages that give you information related to health on pregnancy and first year of raising your child. And other things, even tools like accessing your medical records. It's really just wide open right now, and this is an area where there's a lot of new development. There's been a lot of new funding for research and programs in this area, and I think we're going to see a lot of interesting things come out of mHealth soon.
Why would someone opt to use mHealth tools?
I think, again, because it's mobile, it can be easily carried around. People do not need a desktop computer, and like we talked about before, there's a lot of people who don't have computers, don't even have phone lines, but do have a mobile phone.
Now, for those departments that are considering using mHealth or mobile phone apps, it might be helpful to know about the demographics of who's actually using mobile phones. Can you talk quickly about that?
Yeah, you can see the numbers here, but what you can see is that it's really getting to be very high penetration. So there's a lot of people out there who have standard mobile phones, and then a lot of people who have smartphones, and you're really seeing very small percentages of people who have no mobile phone at all. So really, and there's a lot of people out there using text messaging as well. So these are great tools to reach a lot of people.
So Jen, being that this is one of your areas of expertise, and what are your thoughts on the use of social media in public health?
Sure, I think these tools, whether they're social media tools or mHealth tools, can all be a great way to communicate both within an organization and also to your population if you're in a public health department. It's a great way to get information out quickly. It provides information in a format people are familiar with, and it's a very interactive tool, which is great. People can feel like they're participating in what's going on. I think there are a few things to consider, though. One is that a lot of these tools will only provide information to those who seek it out. So, for instance, if you have a text messaging program, someone would have to sign up to get those text messages. A lot of these tools, like Facebook, need to be monitored for accuracy and appropriateness of information, so it does require staffing to keep those tools up and running. And because of some of these use statistics we saw, they really shouldn't be relied on as the only way to get information to people. I think the main things I really want to leave people with today is that it's really important to think about the different tools and think about which ones are best for the specific goal of what it is you're trying to do at that point in time. And then knowing which tool is the one that's most widely used with your specific target audience. I think John will talk a little bit more about that, but you can really miss a whole group if you go with one tool and it just happens to be the tool they're not using, even though a lot of other people may be using it. So it's really important to know your audience.
Very well said. And what do you think we need to do, or where do you think we need to go in terms of the future?
Well, I think what everyone's really talking about right now is that there's a lot of people using these tools, but we really don't have a lot of evaluation data. A lot of that work is going on right now to try to evaluate the effectiveness of these tools for public health purposes, but it's not really out in the literature yet, so we're hoping to see some of that in the next couple of years.
Well, Jen, thank you so much for this information. You've done an outstanding job laying the foundation for us and really helping us understand. And although we've had a limited amount of time today, I think it's fantastic that you're willing to answer some of these questions and ideas for folks down the road. So greatly appreciate it so much. Well, thank you, Jen. And now let's turn to John, who's here from the New York City Department of Health. John, can you tell us just a little bit about what it is that you're doing there?
Sure. So I'm going to speak, I think, about some of the experiences we've had at the New York City Health Department. And, you know, a few years back, I guess sort of late in 2008, we began to evaluate the media channels that the health department had access to. And there was a change happening. And quick example, we looked at the print media landscape, and there were, in 2007, 13 reporters, you know, sort of dedicated solely to covering health. And by the beginning of 2009, there were 0. You know, obviously that's something that's been documented. And also our audience was increasingly moving towards sort of this Web 2.0 world. We realized that's sort of where we needed to be. And we also had a number of examples where we did traditional media or marketing campaigns that didn't reach target audiences, for example, teens. We did a subway poster campaign for around young Latina depression, had very few phone calls as a result of that. We realized, well, of course, teens are probably not going to respond to a subway poster.
And what were some of the reasons the New York City Department of Health decided that to go ahead and start using social media? What did you see in terms of the benefits?
Yeah, some of the same things that Jen sort of spelled out. I mean, social media creates a different dynamic with how you interact with sort of your constituents. I mean, it's much more interactive and conversational, and it promotes trust sort of and transparency. And don't underestimate putting a human face on government for people. And I'll speak to a couple examples, I think, later on. But it also is inexpensive. It can be sort of done quickly. It is easily shared, and that's the inherent component to it, is it's shareable. And as we're increasingly finding, it really provides for much better mobile access in a lot of cases as well.
So John, let's talk about some specifics. Okay. The New York City Department of Health started using, my understanding is MySpace, back in 2008. What can you tell us about that process? How did you use it, and how did it go?
Yeah, so out of that Latina depression campaign, we decided to use MySpace. We realized that sort of would be a better place to reach teens. Developed video blogs around different mental health topics, depression, bullying, things like that. And we put these videos up on MySpace, but we had some anxiety over interacting directly with the public to a certain extent. And also because of the topics themselves and the sensitivities around it, we were worried about people, if they presented, if, you know, they were going to harm themselves or what have you, and what was our liability. So we turned off any user interaction, which you could do back then. Yeah, I don't believe you can do that anymore. But so basically it became a television show, and it really wasn't that engaging or interactive. But we learned a lot from that sort of experience, and that led us to sort of our next forays.
And what about the use of blogs?
So yeah, our next sort of endeavor was a blog that was successful at times, but I think we learned a lot of lessons, largely just sort of growing pains within our department, around identifying the right people who could be sort of personalities, who could be the right authors, who understood the tone and the lack of formality maybe that a blog needed. And I think it also showed us that we needed to change a little bit how we approved things. We needed to give some people some more autonomy and authority sort of to act in this new space.
So it seems as though you've had some opportunities to learn a bit about what works and what doesn't work, and what might present challenges. What's your current strategy? So
our strategy right now is to really use a diverse array of social spaces to reach, again, a diverse demographic sort of constituency. So again, our demographics may vary from platform to platform, so we realize if we want to reach a certain group, we need to be sort of on that platform. We need to present our information in a multitude of ways as well. But our goals are really to sort of create or reinforce brand awareness and establish our agency as an authority on specific topics. And ultimately, though, also it's about expanding our reach, which is something I'll stress a lot and talk about in the next slide.
And it seems like there's been some discussion about the ability to reach people using social media. Why is it that reach is so important as a health department or really any agency working in public health today?
Yeah. As I said before, sort of the inherent nature of social media is that it's social and people want to interact and share things and retweet and reblog and so on. And for me, the great analogy is the village green. Information is out there and it spreads by word of mouth. The power of the social media is that it's searchable now and it's in a digital format and can be shared very quickly. But the point of that is that we can spread now our messaging much further than we could on our own. Again, considering that change of the media landscape, as I mentioned before, now we have these other opportunities to get our messaging out there and spread it to a very sort of much larger audience. And I think that's a really good fit for public health because in many cases we're trying to simply educate people, change hearts and minds, if you will. But I think one key point to make is that, and this has sort of been well documented, Facebook and Twitter are very good at doing that, at helping you expand your reach, but they don't necessarily translate into conversion. So if you want someone to walk into a clinic or call a helpline, that's not going to happen. People want to stay within the social media. They'll share your message, but they won't necessarily take a real world action.
Now, you've talked to us how the New York City Department of Health has used MySpace as well as blogging, and you're also using Twitter, isn't that correct?
It is, and I think we're starting to focus more of our energy and efforts into Twitter. Twitter has certainly grown over the last couple of years, and we see it as a broadcast technology. It accommodates certainly a variety of topics. It's obviously the format is very digestible for people, and it's a great tool to link back to our Web 1.0 website, for example, and refer to other information and to share other information. We've seemed to be very successful at sharing information to a much wider audience than we could otherwise if we weren't there.
Tell us about New York City Healthy and how that Twitter account works.
Sure. So that's our main Twitter handle, as it's called, and the tone is sort of casual and conversational. We use it to cover all the topics that the New York City Health Department may be involved in, and so it's very, very diverse. And it's basically aimed at sort of what we would consider an everyday New Yorker. And it's hopefully friendly and helpful. It will connect them to information and services. It may promote some of the things that the agency is doing. And at times we may also even use it to advocate for certain policy things.
You talked earlier about establishing the department as an authority, and I understand that your commissioner, Dr. Farley, has his own Twitter account as well. Is that correct?
It's true. We just launched his account in April, and I think this is probably a good example for others out there who maybe have not sort of jumped into Twitter. Dr. Farley was sort of understandably cautious. He's as a public figure, was concerned about how it would sort of be perceived, and I think that so the tone on his account is a little bit more authoritative. He's also providing guidance and information, and at times also the information is more reflective of some of our policies. But I think a quick point here is he's very much supportive of promoting colonoscopy as a way to save lives. And last week he tweeted something about colonoscopy saves lives, and he mentioned that he just had his own one done. It was very widely shared because it shows that when it shows that there's a real person behind sort of a Twitter handle like that, that's what it's all about. People want to sort of engage with a live human being.
Now, you also use Facebook, which is one of the big social media tools. Jen shared with us earlier and talked about that. What are the trends, or how does it tend to a lot of concerns about how to keep the discussion appropriate? What can you tell us about your strategy?
Yeah, we do have a lot of experience, I would say, in Facebook. We've made some mistakes. We've launched pages that we've taken down, and I don't think there's anything wrong with that. We've learned some things from those experiences. We took the approach, though, from the very beginning to make our Facebook pages more tailored to an individual topic, and we felt that would be a better experience for the community, would galvanize the community better around a topic, but it helps to keep people on topic. I think if we were to have a general Facebook page about the health department, well then everything in essence is on topic, and that means if people want to make negative criticisms and such, then we would have to live with that. But by focusing it more on an individual topic, and I'll show some examples, we then sort of have a lower threshold for removing off-topic posts or posts that are offensive. I'm certainly not advocating for censoring things, but it's important to know that, and over our experience, we've maybe, removed only a handful of posts over time, but it does, because I think we find that it just keeps people on topic more, as opposed to having sort of a general site that they would feel more open to sort of going off topic.
So John, there are several Facebook pages used through the New York City Health Department. Can you tell us about them? The first is NYC Condom.
Right. So the New York City Condom is a branded lifestyle brand condom that we simply put our own wrapper around. But there's a lot of misinformation out there about that it's cheap because it's a city condom and whatnot. And so the Facebook page was really designed to help address that misinformation. And I think it's been very successful at doing that. We have to address it over and over and over again, but it's a way to engage with people directly who will make some negative comments on the Facebook page. We can be responsive, almost immediately, and everyone else can see that. And that's sort of an important point, I think, to make too. People need to know that you're minding the store to a certain extent. And I think that you see it as an opportunity to address misinformation, but also to show people that you're there, again, paying attention and are being very responsive.
So it's not censoring, but it's monitoring, so to speak.
Absolutely.
And there's also NYC or New York City Quits. That's a Facebook page you have as well?
Yep. So I think this is also another really valuable lesson. We created this page really to promote you may be familiar with our somewhat gory anti-smoking commercials in New York City. And we really just thought of it naively to say, okay, let's continue to promote what we're doing. And if the interesting thing happened, the community transformed it into a support site to help each other with quitting smoking, which has been really remarkable. I mean, they're very passionate. I think it also shows how hard it is to quit smoking. But it's very easy to create engagement on that site because people are so supportive of each other. People who have been quitters for 20 years will come to the site and help support other people. So it's sort of very easy to create some engagement there. And it's been transformed into something that we didn't anticipate, which I think is also a really good lesson, that sometimes it goes in directions you're not ready for.
Let's delve into that a bit more. How does that tie into the anti-smoking campaign and the marketing that you do around it? Right.
I also want to make that point clear, too, that I think there's an attitude among some people that if you build it, they will come to a certain extent. If you build a page or you create a Twitter handle, everything that you do here requires some kind of promotion, whether it's internal promotion on your regular websites, in your email signatures, or what have you. I'll talk a little bit more about buying Facebook ads as well in a moment, but it has to be promoted, and it's not going to just sort of, community is not going to crop up by itself. So we've done a lot to help promote and drive people to these Facebook pages, because then once you have that community, then you can do some things with them. So what we've done beyond just creating a community is reach out to influencers in the community. We have an annual nicotine patch and gum giveaway. And this year, in March, we reached out to some sort of really large digital influencers, people from like The Gothamist and from Mashable and things like that, to help spread our message, again, to much further of an audience, or much larger of an audience than we could have done on our own. And I think it was very successful. We had really terrific reach. Again, not the sort of real-world transactions that we would have hoped for. People didn't call our 311 information line as much as we would have liked.
Well, speaking of successful programs, I understand that your Eating Healthy in New York City Facebook has been extremely successful. Tell us about that.
It has been. It's our most successful Facebook page. It has almost about 40,000 followers right now. People are very passionate there about eating healthy and leading a healthy lifestyle. This is a page where we've been very focused on buying Facebook ads to drive people to that site. Facebook ads are, I think, crucially important to build a community. They're not necessarily that expensive. I mean, our ad buys are in the $5,000 range, and that will last maybe a few months even. But the more you buy the ads, and even now there are additional sort of flavors of ads that Facebook offers you called sponsored stories that help amplify when people are liking your page or interacting on your page, that their friend network basically see what's going on and creates more basically exposure for your page.
So in addition to Twitter, blogging, Facebook, and MySpace, your department also uses YouTube. Tell us about it and how you're using YouTube.
So YouTube is, in essence, a video sharing site, and it's been a great way for us to house and sort of even categorize a lot of our television commercials and other videos that we've produced. And it's a great way for people to share it, comment on it. One thing I will say about YouTube, I cynically call YouTube sort of the Roman Colosseum. We don't pay attention to the comments and things like that are there. I mean, there's a lot of thumbs up and thumbs down. we're not so concerned with what really people are saying, but just that people are viewing it and sharing it. We've also started to develop videos now solely for YouTube and not without an intent to ever sort of put it on television. We've had some things go viral, and for example, we had a video then that sort of CDC took and is now running nationally, although we developed it solely for YouTube originally.
Tell us a little bit more about the videos that you're posting on YouTube.
Right. So the Pouring on the Pounds campaign is one that we've probably done the most for YouTube on. Some people may be familiar with these ads. There was the man drinking, called Drinking Fat. He poured a soda and it turned into fat, and that was one that went viral on YouTube. We've had almost 1 million views on that. And we've developed some other videos in that sort of series now of man eating sugar, and that was one that I just mentioned that CDC has now taken and is running on television.
And John, now what about the use of these tools as it relates to smartphones? Is that taken into consideration at all?
Yes, I mean, as I said, I think these social media sites are much more sort of mobilely accessible than our sort of regular a website is.
Okay. And your department has certainly done a lot in this area. What do you see as the next steps in using social media?
For me, I think the next steps are, again, there's always new platforms. We've just recently created our Pinterest boards. That's sort of an evolving, I think, platform for us. The demographic breakdown of that, I think, is interesting. I mean, we use Tumblr as well, and I think people will say that Pinterest is Tumblr for women. And so, again, we have different groups we want to reach. We need to be on those platforms.
Well, I'd like to get some of the questions into each of you, from our audience in the time remaining. One of the questions we have, we've worked with underserved populations that may not have access to computers or know how to use them. Do you have any suggestions on the best way to reach these groups or how to educate them on its use?
I'll just start. We do have that issue in New York City. We have certain what we call district public health offices that are 3 communities in the South Bronx, Central Harlem, and Central Brooklyn. And we've recently gone out to do some surveying of those communities to see how people are accessing health information, how they're using mobile, and how they're accessing social media. And as Jen sort of mentioned, there is this digital access divide, but I think what we're finding is that everyone is online in some form or another. I think in those communities, it is largely mobile. That is their primary channel. But what we're finding is that they're very active on mobile. And I think also with certain demographics such as teens, they're very active in text messaging. I think text messaging is the predominant communications channel. So I think the realization is that people are there and they're using it. It's not so much that we have to kind of educate them to find our information. They're already there. It's really about, are we there? Is our information out in these channels?
What do you think, here's another question, are the easiest social media outlets to use or tools to use?
I don't know if it's a question of easiest, because I think they each have their own kind of pros and cons and challenges associated with them. To me, it's more a question of what is it you're wanting to do and which tool is appropriate for it. So if you want to show people how to do something, then maybe posting videos on YouTube is your best tool to do that. If you're trying to engage people in a conversation, then something like Facebook page might be better. Yep. What are your thoughts, John?
Oh, I agree. I think Twitter has become the predominant sort of broadcast. We call it sort of the tip sheet now. I mean, it's what I think both the media and individuals are looking at because it is so temporal and so fast and digestible. And in many ways, I would say if use the word easiest, that would be the easiest in my mind.
I agree. Yeah.
John, what about Foursquare? I don't think Foursquare is quite as well known as some of the other tools we've been discussing, but your department is using it. What is it and how does the New York City Department of Health use it?
Again, we sort of just recently moved into that, and it's basically a site that allows you to share information tied to physical locations. Interesting point here, we have physical locations like STD clinics or TB clinics, and I felt like the sort of currency on Foursquare is checking in. You physically check in and it says, I'm here in this location. Would people want to check in at an STD clinic? And we felt, well, probably not. But when we started to look at Foursquare more closely, people already had created our venues, basically, and had checked in there. Don't underestimate people's willingness to share personal information. And you can leverage that in a way that will help you get your additional information to their networks of friends. And so we've gone in and claimed our venues. We've established all of our sort of sites. We're also trying to use it around National HIV Testing Day. We sort of posted all of the free testing sites that were available in the city that day. So I think Foursquare is probably more dominant in maybe some urban settings right now. I know New York and San Francisco are sort of the big ones, but as people walk around the city, it's a great way for them to sort of interact with your information geographically.
And you touched briefly earlier upon how the department's using Tumblr as well. Yeah,
and Tumblr is a blogging site that's sort of more verbose than, say, Twitter. We use it to tie our dynamic content to Twitter. But it's also, we're finding a great way. We have a lot of these sort of partnerships with like healthcare providers or nonprofit groups, and we need a way to create a social space for them to interact, but that's not necessarily public. It's not necessarily sort of our Web 1.0 site. And so Tumblr's become a good way, I think, to create these spaces just for those sort of groups that are, our department as well as these larger sort of partner groups that we've created.
John, now one of the things that people wonder about is how effective all of this is,
Yeah.
all of this social media, and how much are we going to get back from what effort we put in, and the New York
Yeah.
City Department of Health has put a great deal in. And is there a way to tell who's using or viewing and how the information is being put out using social media?
Right. So there is a wealth of metrics out there, and I really want to stress you have to track what you're doing, if not just to show success, if that's really important, but just to learn and adapt and expand. I mean, in the beginning, we were solely looking at how many fans do we have on our Facebook page, or how many followers do we have, and then we realized that reach has become sort of more important to us. Facebook gives you fantastic insights. You can look at their sort of canned insights, and then you can actually download an Excel file that is like 45 tabs worth of information. It's pretty amazing. Twitter, on the other hand, doesn't really give you a lot of metrics, and so there's some tools out there that you can use. Twitterlizer is one that we happen to use. It's rather inexpensive, gives you a lot of great information, but it's basically just I want to stress that you really have to follow sort of who's using your sites, are you reaching your intended audiences, and so on.
And there's actually a statement that's come in from a viewer. It says, our asthma education and prevention program uses Pinterest. Our boards were started fairly recently and have had success with many organizations following us. And I'm sure you've seen that elsewhere as well with other organizations.
Yeah, no, it's great that they've started to use that tool, because it is fairly new, and the fact that they can pick up with a new tool and get using it is great, and that it's been successful. It's really a great example to hear about.
Yeah, I think, as I said, we've just really started using Pinterest. One interesting bit of information out there is that research around Pinterest has shown that Pinterest may lead to more real-world conversions than some of these others. As I mentioned before, people want to stay in Facebook or Twitter, but Pinterest may actually lead people to take some action, whether it's go buy something or go to a physical location. So that's going to be intriguing to me.
Especially the recipes. I know a lot of people have used it for different recipes, tracking recipes, especially things for healthy eating, that kind of thing. And so people will, then go out and buy the products and make the recipes and things like that. So I agree. I mean, my experience with it has been that people actually do try to implement some of what they're seeing there, which is interesting. I want to just quickly get back to one thing we talked about earlier about, reaching certain populations who may not be using these tools. I think one thing to point out is that even if there are people who are not online or who are not using these tools can still be effective in reaching their social network. So for example, you may have a group of moms, and there may be some moms who do not get online, but they have their own social network of people and other moms that they talk to. So if maybe some of those moms are online and getting the information, then they can verbally spread it to the rest of their network. You could think of diffusion of innovation theory, for instance, where you have people who are kind of like the lead adopters in a population, and you usually target them to try to transmit the information across a group. So I think it's, again, if you can understand if you have a group that is, you're a little bit worried about how to reach them, trying to understand where they get their information from, and even if it's not online, you can still use these tools to target people in their group.
Jen and John, thank you so much. We've gotten a lot of information in today, and I appreciate both of you for being with us. And
thank you.
Please remember to fill out your evaluations online. Your feedback is always helpful to the development of our programs, and continuing education credits are available. To obtain nurse continuing education hours, CME, and CHES credits, learners must visit www.phlive.org and complete an online evaluation and the post-test for today's offering. As a reminder, you can also download the companion guide to this broadcast on our website at phlive.org. An archive of this webcast will be on our website within 2 weeks. And please join us on August 2nd for our breastfeeding grand rounds on coalition building and paid family leave. I'm Joyelle Ray Alexander. Thanks for joining us on Public Health Live. Thank you, Jen.
Thank you.